What we discussed last time, and probably some thoughts about how we can put it in practice. So today's session will be a relatively shorter one because we have dealt with the major part which we have to, and today mainly we will be looking at developing a plan of action. How can we put all that what we learned last Monday into actual practice? But before that, I want to take you through some simple steps of helping students learn. In fact, if you compile the reasons for students coming to their teachers, then the most common would be yaad nahi rahe. So that would probably be the most common reason for students to come to their teacher. Padhte to hain, yaad nahi rahe. How many of you have faced the same thing? All of us. Even I, many times, you would read something, उस time तो पूरा समझ में आ जाता है, वो बात पे आते हैं. So, and as I said last time, there is no difference in the amount of gray matter between a topper and a student who fails. Both probably have the same intelligence. Then what is the difference? How you use your intelligence. That makes all the difference. Because if you are not making proper use, it's just example if I give it to you. In your house, you have a cupboard and you have stuffed all the clothes into that. And you want to find out one hanky. So what will you do? Throw out all the clothes and then and then come out with the hanky. That is one way of doing it. Other way is you properly arrange your trousers one side, shirts one side, socks one side, hanky one side. So when you want to find a hanky, you know where you have it. Sometimes what happens? Black trouser, but this shirt doesn't go, that shirt doesn't go. So then again you shuffle the whole thing. Which shirt, wow, what should I do? Especially I'm using the example of shirt, but I'm sure with the other side, the problem will probably be more acute. So if there was some mechanism, where you could tie things together. A shirt, इसके साथ में ये वाली पैंट, इसके साथ में ये वाला कोट, इसके साथ में ये वाला हैंकी, ये वाली socks, ये वाली tie. So you pull out one thing, and the whole lot comes out. So probably it will become much easier for you to get dressed up without going through all the stress of how to select and how to pick. Something similar happens with studies. If you try to think sometimes, there's a lot of similarities between the way our brain works and the way a computer works. And I am not surprised because whosoever designed the computers probably had the prototype of the brain in mind before deciding how a computer would work. Computer fortunately has a delete button. Your mind doesn't have a delete button. So whatever goes in is in. There is no way you can throw it out. The only thing what happens is it gets buried under more information, and finally you don't know where did I keep it. इतने बड़ी होता है ना, फोन नंबर याद करना होता है, वो कितना था 98 था नहीं 7 था नहीं, वो मेरे को मिला था,
मैडम मिली थी एक बार कहीं, नाम क्या है, नाम याद है।
You know, you have met somebody, you know who that person is, but you can't recall. Because all that thing is buried under whole lot of information. And therefore, this management of your mind and memory is actually the one which separates a good student from not a good student. And if there was a way to teach this to the students, in fact, for medical courses, they have a foundation course. Even if it is 1 week or whatever, you can still organize it at your departmental level. So at the beginning of the program, say 1 hour if you devote, it will go a long way in helping your students how to memorize and how to really make best use of their memory. So next 40 minutes or so, we will be talking about how we could help the students to learn. And primarily, I am talking of management of memory. So when we talk of helping students to learn, there are few strategies and very effective strategies at that. So what are those three? One, learning in context. Right? Adult learning differs from child learning. Children learn for the sake of learning. You know, they'll memorize poems, they'll memorize tables because they have to narrate those in the examination. That is their only purpose. But when adults learn, they don't learn because of this. You know, somebody comes in your class and says, this is very important, you must memorize that. I don't think that has any influence on any of the students. Why students learn? So that they can use that information in future. And all the new methodologies that we are using, like for example, early physical exposure or foundation course, or teaching on the bedside, they are all meant for this purpose only, so that the students know when and where to use that information. Last time I had given you an example of Krebs cycle. You know, we all teach Krebs cycle. So what is the typical Krebs cycle? Any biochemist? Any biochemist? So what is the typical Krebs cycle? Memorize Krebs cycle? Forget? Memorize? Forget. That's what happens. I'm sure none of the clinicians, even professors, head of the departments, medicine, pediatric surgery, will be able to tell you what is Krebs cycle. Because we never learned it that way. We learned it only because there will be a question coming in the biochemistry paper which you have to attempt, so you must learn about Krebs cycle. Finish. And that is true of many things. So many things we teach them. Anatomy, for example, physiology, for example, biochemistry, for example. Don't look at me like this. I also went through the same stages. So many things we teach them कि बेटा पढ़ लो, किसी दिन काम आएगी. वो दिन कभी नहीं आता. You know, when he says, oh wow, देखा वो पढ़ा था आज काम. Because when you go to medicine or when you go to surgery, you probably have to relearn. The way you learned it in anatomic physiology doesn't come to your aid when you have to write a medicine paper or you have to write a surgery paper. And then on top of that, medicine and surgery people will tell you, अच्छा, ये नहीं पढ़ाया biochemistry, ये नहीं पढ़ाया anatomy. So it's not a problem of students' mind, it's a problem of memory, how you manage your memory. So the first point is learning in context. Second is cumulative learning. You know, whenever you start a new chapter, for example, unlike computer, you don't press open a blank document. and on that blank document, you write good notes, and so that each document is separate. That doesn't happen. Your mind is not a clean slate. It already has lot of information. Now, when I am talking to you about learning and memory management, it's not that you are listening with a clean slate. You already have your own experiences. You already may have read about it somewhere else. Some of you might be thinking, ऐसे नहीं होता, मैं जो मेथड यूज करता हूँ वो बहुत अच्छा है. Somebody else might thinking, ultimately इम्तिहान में लिखना है, what difference does it make? So all these kind of thoughts might be going on, and they will always distort, if I use that word, the way you perceive the message which is being delivered. So I might give you some tricks, but you will modify it based on your own past experiences, your own learning, your own information which is stored in the mind. What I said is probably on the negative side, but you can also use it on the positive side. When a student comes to you in anatomy, for example, now these days they have learned a lot of anatomy in +2. They have also learned biochemistry and physiology, many concepts in +2. In fact, my son asked me some questions related to biochemistry in +2, which were a shocker for me when I couldn't answer. I had to go through some material before I could answer those questions. So if they already know something, so rather than starting from scratch, why cannot we build on what they already know? So that is the concept of cumulative learning. Because your mind is not blank document. Your mind is already programmed. And third is how you store your material. I've already given you some examples of how you store your material, because that ultimately makes all the difference. We discussed last time about the ability to recall. I think I gave you the example of Bird in the war. He could not recall how to use those weapons when he needed it most. And that resulted in his death. So, any information which you cannot recall is actually useless. What is the use if you can't use it, or if you can't put it to practice? And I often remember when you go to some library which has a good indexing system and all, they will tell you, or they will have actually notices put up that don't put a book on the wrong shelf. A book put on the wrong shelf is lost. If you put an anatomy book in the medicine shelf, nobody will be ever able to place that. So same way, organizing the material and putting it into the proper compartments is something which becomes crucial if you want the student to recall the information when he needs it most. And when does he need it most? When he is seeing a diabetic, for example, that is the time when he should be able to recall Krebs cycle. When he is seeing a patient of enteric fever, that is the time when he should be able to recall the antibiotics which affect gram-negative bacilli and what are their toxic effects and all that. If he cannot do that, then he will have a problem. The first one, learning in context. Now, when you learn in context, you remember better. And there is one experiment which they did, and actually this is the basis of problem-based learning. You give a problem, and then you learn in the context of that problem, so that when you encounter the problem in future, you are able to use all that knowledge. So they had two people see each other, once in a grocery store and once in a park. A different one in grocery store and one different one in park. So the experimental subject was able to recall the name of the person he has seen in the grocery store, but he could not do in the park. It sounds very simple, but has a lot of message and lot of. You will be able to recall the toxic effects of ciproflox more when you are actually prescribing it to a patient with atrophy, rather than when you are sitting in a surgery class and talking about a fracture. So if you teach in context, recall becomes easier, retention becomes better. I said there is no recycle bin, but there is an attrition. If you do not use that information, slowly it keeps on fading until a time comes when you are no longer able to recall that information and use that. So if you use case vignettes, for example, some of you who have done that faculty development workshop would remember how we were promoting case-based MCQs or case-based essays. So rather than saying write an essay on cataract, you give a small case. A 60 years old male presents with decline, progressive decline of vision, there is history of diabetes, and he is not able to see during the night, but in daytime he has little better vision. So what is your diagnosis and all? Now once you do that, then recall, retention and recapitulation all become very easy. It also provides an opportunity for application of knowledge. And remember, adults learn only to be able to apply that knowledge rather than for the sake of learning. Adults don't learn because I want to learn. I want to learn for, that is the reason for their learning. And then assessment should also be contextual. Don't just say enumerate 10 toxic effects of omega-6. 7-day-old male neonate brought with suspected neonatal septicemia, prescribed cefotaxime and amikacin, and after 4 days mother complains of blah blah blah. And so what is your diagnosis? Now putting the whole thing into perspective and coming out with toxic effects of amikacin will be more valuable rather than simply asking them to write down the toxic effects of it. Second, cumulative learning. Build on what is already known rather than starting from the scratch. And this is not only for +2 and medical studies. When they come in third year, for example, they have already learned a lot of anatomy, physiology, mechanisms. You don't have to repeat it again. By the time they are in final year, they may have seen cases of diabetes, they may have seen cases of typhoid. They may not be expert in managing those, but they have seen that. So find out what they already know and build on that. That will help them to put the new knowledge in the proper place. It will help them to use that knowledge where it is actually needed, and it will help them to recall it at a faster pace when they encounter a similar case again. Sometimes, what is a difficult topic? We all say it is very difficult, very easy. So try defining what is a difficult topic. बोलो ऐसे ही बोलना। उसका कोई क्राइटेरिया होना चाहिए।
वो लॉजिक नहीं बन रहा।
Less frequently asked.
I don't think less frequently would make it difficult.
Generally
actually तो अगर less frequently पढ़ा रहे हो तो probably वो difficult नहीं है, तभी आप उसको ज़्यादा ध्यान नहीं।
But sometimes sir, it sounds like
So
a
language problem, which are
hardly
terminologies.
it should be asked.
Language is difficult or terminologies are there, something we are not able to understand.
Any
Not
other?
able to write what we have learned, reproduce what we read.
We call.
Difficult to memorize.
Out of
पहला
context.
सेंटेंस बहुत अच्छा था, क्या बोले थे आप?
लॉजिक नहीं बता
लॉजिक नहीं बनता, यू नो। और लॉजिक क्यों नहीं बनता? क्योंकि आप अपनी प्रायर नॉलेज को एक्टिवेट नहीं कर पाते। I'll give you one example. Interpretation of arterial blood gas. Now, it requires you to know the normal composition of gases. It requires you to know the role of kidney and role of lungs in maintaining the ABG composition, and what happens to kidneys when, because of the lungs, there is a problem. For example, if there is respiratory acidosis, then what do kidneys do? Or when there is a metabolic alkalosis, then what do the lungs do? You know, so when you have to activate your prior knowledge, so a difficult topic is one which requires lot of activation of prior knowledge. और इसी को थोड़ा और एक्सटेंड करें आर्ग्यूमेंट को, तो अगर आप उसकी प्रायर नॉलेज को एक्टिवेट नहीं कर रहे हो तो हर टॉपिक डिफिकल्ट बन जाएगा। You ask somebody to recall immunization schedule, फटाफट कर देगा। Why? क्योंकि उसमें प्रायर नॉलेज नहीं चाहिए, एक्सेप्ट कि किस उम्र में कौन सा इंजेक्शन लगाना है। बट आर्टीरियल ब्लड गैस में यू नीड लॉट ऑफ information from topic A, topic B, topic C, topic D, and then put everything together. So, before taking your class or before starting your lecture, for example, activating prior knowledge is a very useful strategy. अगर आप, let's say, I can give you only medical examples, but suppose you are trying to teach typhoid in clinical subject, pediatric medicine. So asking them what is the type of typhoid bacilli है, ग्राम पॉजिटिव है या नेगेटिव है, उसका ट्रांसमिशन कैसे होता है, how long it can survive in food items. You know, these are kind of things which will help them to recall what they had learned in microbiology and what they had learned in pharmacology. So it will make them easy to understand and recall what you are teaching. अगर वो सब करे बिना आप सीधे शुरू हो जाओगे, then it will put a loop. It is called a cognitive loop, and some may handle, some may not handle. And third, probably the most important, is reflection. One of the famous poets, William Davy, he said, "You do not learn from experience." Might be a little shocking. You don't learn from experience. You learn from reflecting on that experience. आपने एक पेशेंट देखा, बहुत मुश्किल था मैनेज करना, कुछ आपने किया, कुछ इफेक्ट हुआ, कुछ नहीं हुआ, ठीक नहीं हुआ, प्रॉब्लम परसिस्ट कर रही है. When you are sitting back now, having a cup of tea and then thinking, अच्छा मैं ऐसे करता तो probably it might have helped him, or maybe I could have done this way. So this reflection is actually one of the very important ways to understand and to stimulate the thinking of the student. In fact, for new curriculum, in medical curriculum, they have put a lot of emphasis on reflections. Reflection gives you an idea of what is going on in the student's mind, and where you can intervene to put things back onto a proper perspective. So keep these three things, and reflections, we don't want very lengthy notes written. It's so all reflections start with very simple question: what happened? It is easy but it is difficult. Because what will happen is most of the time the students will write a complete note on I was taught this and I was taught this and I was taught this. That is not what is required. What is actually required is, for example, today we saw a patient of aggressive fever who was not responding despite getting azithromycin for last year.